Good morning for the Americas, good afternoon to Europe and Africa, and good evening for Asia. My name is Hans Bratsgaard, and I'm the Norwegian ambassador to the United Nations here in Geneva. Thank you so much for joining us for the fourth RightOn Web Chat, this time on the gender impact of the COVID-19 virus. It's a great honor to have the participation of Madame Michelet Bachelet, the UN High Commissioner for Human Rights, in today's dialogue. Thank you so much, Madam, for joining us this afternoon. In these times when our societies are facing unparalleled challenges on a health, economic, and sociological level, it is more important than ever to keep the human rights dialogue going. As UN Secretary General Antonio Guterres made clear last week, COVID-19 is a public health emergency that is fast becoming a human rights crisis. People and their rights must be front and center in our response. Norway is glad to be one of the partners of the RightOn project, which aims to highlight key human rights questions during this crisis and provide recommendations to governments and other stakeholders on how to build back better in a way that leaves no one behind. I'm now happy to give the floor to my colleague Anniken Enersen, head of our mission's human rights team, who will set the stage for this week's discussion. Thank you so much for your attention.
With a call to use the 25th anniversary of the Beijing Platform of Action to re-energize global efforts to promote women's rights and gender equality. Now, 4 months later, we are fighting to maintain the limited but important progress that has been made, to quote Guterres. Why is this the case, and where do we go from here? In short, this is the subject of today's RightOn debate. Starting with the why, it has become painfully clear over the past 2 months that the COVID-19 pandemic and the associated economic downturn are having a disproportionate impact on rights of women and girls. Some examples of this have already been in a video, and I'm sure we will hear more from our panelists today. As we discussed during a previous RightOn session on equality and discrimination, the virus itself may not discriminate, but its socio-economic impacts do. The pandemic has laid bare and exacerbated existing inequalities, including those faced by women and girls. The chair of the CEDAW committee, Hilary Gebedema, has put it well. Because of pre-existing gender inequalities and deep-rooted discrimination, the consequences of the current crisis have affected women in disproportionate manner, while at the same time placing increased responsibilities on women's shoulders at home, in the health workforce, and in other sectors. We should note, though, however, that there is an increasing opportunity to build back better, including by building more equal and resilient societies. As the Secretary General said recently, gender equality and women's rights are essential to getting through this pandemic together, to recovering faster, and to building a better future for everyone. Today's discussion will look at both of these angles, the disproportionate impact of the current crisis on women and girls, and how to ensure that women's rights are placed at the center of the common drive to build back better. Charlotte from the Universal Rights Group and I will co-moderate the session today. But we also want to involve all of you in the audience. So please use the chat room to send in your comments and questions, and some of which will then be posed to our experts during a second round of questions and answers by our colleague Natasha from DiploFoundation. We have an esteemed group of experts lined up for you to take this discussion forward. With us today, we have Her Excellency Michelle Bachelet, UN High Commissioner for Human Rights, Mr. Mohamed Nassiri, Regional Director for Asia Pacific at UN Women, Ms. Branka Simonovic, UN Special Rapporteur on Violence Against Women, Ambassador Socorro Flores Liera, Vice President of the Human Rights Council and Permanent Representative of Mexico to the UN in Geneva. And last but not least, with us today, we also have Monica Ferro, who is Director of the UNFPA Geneva office. Now I would like to hand over the floor to Charlotte, who will get the discussion going with our speakers. Charlotte, the floor is yours.
Thanks, Anniken, for giving me the floor. And immediately turning to our esteemed panelists, we will start with Madame the High Commissioner. In the UNSG's announcement last week on placing human rights at the heart of the world's response to and recovery from the COVID-19 crisis, the SG said that gender equality and women's rights are essential to getting through this pandemic together, to recovering faster and to building a better future for everyone. What concrete steps do you and the SG, working with world governments, envisage to put this important principle into practice?
Well, thank you for the question, because both the Secretary General of my office have issued briefing papers showing the impact of COVID-19, particularly disproportionate impact of COVID-19 on women and girls, and also guidance on concrete measures that can be taken by governments to ensure specific attention to gender equality and women's rights in the response, and of course afterwards in the recovery of the COVID-19 pandemic. And this includes recommendations to address gender-based violence, because we have seen the increasing numbers of reports of people who are confined with abusive partners, how violence against women has increased dramatically. Address also the disproportionate economic impact of the economic crisis on women, because as in many countries, 70% of female are in the informal sectors, and with the lockdowns, they have had a terrible impact of job losses or the incapacity to have the daily basis income. And also, we want to ensure that they have access to health services. And there are a number of promising practices being put in place by member states all over the world, although support services for victims of gender-based violence being declared essential, because in some other countries they have locked down, they closed those services, and women who are victims of violence don't have access to services. Accessible systems to alert authorities and protect victims, economic incentive, of course, targeting women and girls, and measures to facilitate access to sexual and reproductive health and rights. Because in many places also they have closed the possibility of having access, because they have sort of prioritized and diverted resources to COVID response and diverted from other women's needs on health. So these efforts are encouraging. However, it is critical that women and their organizations are consulted and have a voice in the design, in the implementation and monitoring of the responses. Because in the absence of their participation, even with the best intention, responses may fail them. Our conversation with women's human rights defenders are a constant reminder of what is at stake. In Guatemala, for example, 75% of working women are in the informal sector. And it's not only the lockdown and the problems that makes, but also that they have no access to protection fund established by the government to respond to the crisis. In South Sudan, many of the street vendors are women. The government allows food stalls to be open, but with the precondition that they have to have hand washing facility for customers, but water has to be bought from water tanks and it's too expensive for most women vendors. Women human rights defenders in Tanzania reported their concerns about internet and phone connectivity disruption and consequent difficulty to reach women in rural areas to provide guidance on GBV services and new referral paths. Unfortunately, from the US to Nigeria, Italy and Djibouti and many other countries, task forces and committees created to shape COVID response and recovery plans are heavily male dominated. So women human rights defenders struggle to have a space at the table. And isolation and the categorization of the work as non-essential has made them vulnerable to attacks and less able to do their work. In the field, what we're doing also, not only this guidance and recommendations to government, but also supporting women's human rights defenders and facilitate dialogue with policymakers. And in the coming, we are daily, in the weekly basis, talking with them to know the challenges that they are having. But also in the coming 15 days, we're organizing webinars with women human rights defenders from East and South Africa on self-care and dignity security, providing them also tools to look after their mental health, well-being, protect sensitive data, and prevent and respond to online harassment and, of course, abuse. In Honduras, just giving some example, we bring to the attention of policymakers, international community, and the private sector issues of concern related to women and girls that require urgent response. So I would finish saying in this that COVID is a test of society. It's a time for solidarity and cooperation. Women, especially those living in poverty and or belonging to marginalized groups, because what we have seen is that COVID-19 has shown us something that we're always known, is that inequalities are there and it's affecting disproportionately people that are victims of inequality. So those women, or either in marginalized groups, minorities or poor, are often hit hard by the unintended consequences of measures designed to halt the spread of the virus. So they must have a voice at the table to mitigate the effect of these measures and help shape responses that leave no one behind.
Those remarks, and also for shining a light on the lived realities of women around the globe, and including women human rights defenders in these very challenging times. Now, before I ask a second question to you, we would also like to share some data on countries with the highest percentage of women parliamentarians, as you can see now on your screens. As you can see, the top 10 is dominated by countries from the global south, including also includes Mexico, of which the permanent representative is also part of this panel today. Now, moving from female political participation in the legislative branch to female representation in the executive, in recent days, many media reports have praised many female leaders from around the world for the job they are doing managing the crisis, with fewer deaths in many of their countries. A lot of people have also praised them for how they have communicated with their citizens, with a level of openness, compassion, and honesty not seen in certain other countries. Do you believe this is coincidence?
Well, I think a few things are not a coincidence that globally women have secured just 25% of available seats in parliament. I mean, as an average, because you show some countries that are much better. A figure that drops to 21% when we're talking about ministerial level. And it's not a coincidence in the past 50 years, 85 countries have not had a female head of state. So I think this shows the figures of years, of decades, of centuries of discrimination against women, especially in the public sphere. But on the other hand, as you rightly said, women leaders from very important countries, Senator, New Zealand, Ireland, Denmark, Germany, and so on, have given, not so on, and some other, have given the most efficient responses to the crisis. And these women acted in firm, informed ways, promoting solidarity, compassion, gaining the trust and admiration of their communities, limiting the numbers of infections, and putting in place systems that have become models for the rest of the world. Rather than trying to attribute their success to other circumstances, we need to acknowledge and celebrate their work, but also, as you mentioned, their style of leadership. And we must use this as an opportunity to dismantle hard-to-die, deep-rooted stereotypes about women being too emotional or not competent enough to rule. And it's also an opportunity to challenge the attributes that are considered necessary for leadership, and usually and wrongly considered male attribute, because compassion is as important as decisiveness. And women leaders show they have both. When we have seen them, they have capacity of very fast decisions. They go quickly to action. They don't come into the denial process and not acknowledging that it's a huge problem. They have had also, I would say, effective messages, clear, transparent, and also empathic, being able to put themselves in the place of people. And they have had great creativity in the solutions. And I have been looking after what everyone has done, and there are certain trends and patterns that are very important. And I'm pleased to see the work of these leaders recognized and celebrated. So we need to use this crisis as an opportunity to transform societies and make them more equal and just. And we can do this not only celebrating women's effective leadership and calling for more women in public life, that we need to do so, but also by recognizing the injustice of care work falling disproportionately on women and by promoting a more equal distribution. We must acknowledge the critical contribution that women make to our societies and the injustice of the gender pay gap. We must call on women's economic empowerment through gender transformative economic recovery strategies and plans, and give women and their organization equal voice in shaping preparedness and response strategy. I said, strategic optimist and also practical optimist. And I think 2020 is the year of women. We have the commemoration of the 25th anniversary of the Beijing Declaration and Plan for Action. So let us celebrate the Beijing vision by using this challenging time to build better, fairer, happier societies. 70% of health workers are female, and we applaud them every day. But let's do more than that. Let's acknowledge the huge contribution that women have in society, and let's build a more inclusive and with more rights for all women in the world. Thank you.
Thank you, High Commissioner, and thank you again for these very valuable insights and also highlighting the creativity shown by female leaders and mentioning the structural elements that still lead to these paltry figures when it comes to females in executive roles. Now, I'm also looking forward to your answers to questions from the audience later in this RightOn session. Now, before we continue our discussion with the rest of our all-star panel, we would like to hear from you, or rather see from our audience what they think about one of the issues that we're discussing today. We have prepared a survey that should appear on your screens now. The poll asks the following question: what will have the biggest impact on women's rights? The health crisis, the lockdown, or the concurrent / subsequent economic crisis? Okay. There are some very interesting results, which I hope our speakers will also touch upon later in the session. Now, moving on with our panel and jumping from the former head of UN Women to the current regional director for Asia Pacific of UN Women, I would like to give the floor to Mohamed Nasiri. And thank you for being with us, Mohamed.
Thank you so much. It's almost mission impossible to come after the High Commissioner, but I believe that her ending statement and also the poll that has shown that most of those who are with us today believe that the economic impact will be the most severe on women. So let me start with what the High Commissioner has ended and say that women make up nearly 70% of the healthcare workers globally. In addition to doing up to 4 times more care work than men, in some countries more than 11 times. At the same time, the professions in which often we see majority of women in the care economy, teachers, nurses, caretakers, are often underpaid and undervalued. In Asia Pacific, they receive 15% less than men. They cannot compete for higher paid jobs than men because they are dedicating more time at home for the unpaid care work. While I hope that the recognition of this undervalued work will last, given that the frontline workers are now carrying us literally on their shoulders, I also know that people are quick to forget. Clapping now is easy, redistributing wealth later is not. Coming out of the crisis, we have to have discussions about new and sustainable economic models that value all work. Women who work night shifts in hospitals as nurses should not need a day job to make ends meet. If this crisis has shown us something, it is the stark inequalities that exist across all societies, from the United States to Afghanistan. Those who are able to self-isolate with food on the table, laptops and internet connection for the child's education, those who are able to work from home and keep their salary, those of us are the privileged few. No one willingly puts their family in harm's way if they do not have to. But the harsh truth is A majority of workers, in particularly women, are casual laborers without social safety nets, without paid sick leaves. We have to completely reevaluate the social contract and the responsibility of the state to ensure that all people in all professions make a decent living. We must push not only for gender responsive policies, but as also Madame Bachelet has said, women's leadership in developing these policies. We must stop applying policies developed by entitled men to entire populations. Women should not earn less under the assumption that the spouse is earning more. They should not quit first their jobs because their partners are earning more. We need policies that value the things that keep our societies afloat. Back to you, Charlotte.
Thank you very much, Mohammed, for those comments and insights that respond to the question of how the current increased recognition of the important work that female nurses and healthcare professionals are doing on the front line, and how we can ensure that that recognition is not transitory and only linked to this crisis, but continues in the world post-COVID. Now, one women's rights issue that has received a lot of attention in the media has been domestic violence, unfortunately, and the possible exacerbating effects lockdowns might have on this issue. I'm therefore very happy and honored that we also have Ms. Dubravka Simonovic, UN Special Rapporteur on Violence Against Women, on our panel today. From the beginning of the crisis, media reports have pointed towards significant increases in domestic violence, intimate partner violence, and femicides during national lockdowns. Both you, the High Commissioner, and the SG have also repeatedly drawn attention to this problem. Could you expand on the heightened risks women and girls are facing during the lockdowns? What concrete steps should governments be taking to mitigate those heightened risks? Ms. Dubravka.
Thank you. Thank you very much for inviting me to participate at this important panel as United Nations Special Rapporteur on Violence Against Women, its causes and consequences. And with respect to your question, I would like to mention that early on 27th March this year, as the UN Special Rapporteur, I have called all states to really focus on measures that are needed to combat violence against women during COVID-19 pandemic, because it is extremely important to see that during this pandemic, women are facing different challenges if they are locked down, if they're in isolation, if they're in confinements, and if they are not able to escape home. That is for them not the safe place. Homes should be the safe place, and all measures imposed by governments are really focusing on regular situation, but we have to see the domestic violence and violence against women, gender-based violence against women is ongoing. It's also pre-existing inequality that is present in all parts of the world. And during the crisis, all those gaps that are present with respect to different measures related to protection of women against violence and services that are needed are also showing that states need to focus on availability of all those measures. So for that reason, I have first issued a press release, and after that I have issued a call for information with respect to data, because now we are seeing from media, from states, from NGOs, from UN agencies, we are seeing different reports on increase of domestic violence against women during those lockdowns. But we are also seeing, for example, from New York Times article that there are also reports that statistical data are not in all states showing increase with respect to domestic violence cases during lockdowns, because women are not necessarily able to use those measures that are available. So this is also important to see what measures are needed with respect to availability of helplines. In some states, there are no helplines available for women victims of violence even before the COVID crisis. And for example, Japan just opened a helpline that will be available for all victims of domestic violence. So then protection measures, if courts are not functioning, if this system is locked down, then protection measures are not available. And for that reason, I am seeing now that there are different challenges in different parts of the world. With respect to shelters, situation is also complicated. In some cases, there are shelters, but they are facing also problems related to quarantines and the regulations needed for protection against COVID pandemic. On some occasions, there are no available shelters. Then police interventions are also important to have available. So my basic message was that states have human rights responsibility to uphold and to protect women's rights during the COVID pandemic. They need to protect women's rights to life free from violence, and they need to uphold all those measures that are needed for prevention of gender-based violence against women and domestic violence, including femicides. They need to have availability of services, and if there are restrictions of movement, women should be, if they are victims of domestic violence, able to escape violent homes and go to shelters. Protection orders should also be available, helplines, different types of help possibilities, to SMS, to pharmacy possibilities to seek help in, what we have seen in some countries like Argentina and Spain and some others. So some innovative measures also needed, because we need to focus on state responsibility also to combat and prevent domestic violence against women and girls, children in general also, and to provide those measures that are needed in line with COVID restrictions and lockdowns, because it is really important to see that women should not be double victims of all those imposed measures. So I hope that with this call for additional information that is available on Mandate's website under the highlights, you will see what is going on also with respect to responses from others. And I have with support from the Office of the High Commission. I am glad that Madam High Commissioner is also with us here. I have also included reference to all documents, responses provided by other mechanisms, UN system in general, and all those that are active in this area of women's rights and violence against women. UN Women, Office of the High Commissioner for Human Rights, but also CEDAW committee that you have mentioned. There is also MESECVI from following the Belém do Pará Convention, GRAVIO following the Istanbul Convention. There are other organizations like the OSCE, also Interparliamentary Union. So there are many now documents that are showing that focus is needed with respect to COVID pandemic, also on gendered impacts of such pandemic and measures to prevent violence against women and domestic violence.
Thank you very much, Special Rapporteur Dubravka. Thank you, Dubravka, for those comments, for highlighting the importance of data, which also help determine what measures are needed, what measures governments need to take. And we will definitely also share links to all those wonderful resources that you've just mentioned with our audience. Now, turning to Monica, data tells us that older men are at heightened risk of suffering from health complications due to COVID-19, yet women of all ages are impacted by COVID in many different ways. Why do you think a gender perspective would be needed in preparing for and responding to the health crisis? Please tell us what health challenges could be easily overlooked from a gender perspective and how to address them. Monica, you have the floor.
Thank you so much, Charlotte. Well, I want to start by thanking the hosts for convening such an important discussion and to share how privileged I feel to be part of this panel. And I just want to say, don't feel surprised if we are all fully aligned, all the participants. It's really a system-wide approach. We are all in this together. And as Charlotte, as you were saying, we know that diseases outbreaks, they affect women and men differently. And we know that pandemics, they make existing inequalities for women and girls and discrimination on other population groups, they make it worse. Therefore, we need a gender lens, but we need a gender lens that also reveals the intersectionality and the overlapping discriminations faced by older women, women with disabilities, indigenous peoples and people of African descent, and just to name a few. And let me highlight that UNFPA has just issued technical guidance on the implications for older persons when responding to the pandemics. And I feel that these are the ones who've been truly left behind, both in policy, both in programmatic approaches, and we need to tackle this if we really aim to leave no one behind. We are calling the attention of governments and communities to the need to safeguard their sexual and reproductive health and rights at all costs, for services to continue, for supplies to be delivered, and for the protection and support of the most vulnerable. And for this, we need data. And given UNFPA's expertise and engagement with the census, we can support in developing what we call quick population mappings that are based on recent census data to know how many they are, where they are, and in what situation they are in. And I know that it's been mentioned more than once today that women account for 70% of the health and social sector workforce globally. And this already makes them particularly vulnerable. But I would be dismissive if I wouldn't mention midwives. And it's also the first International Year of the Nurse and the Midwife. And midwives do much more than delivering babies, although per se, that's already an amazing thing to do. But they educate, they empower women to live healthy lives and to exercise their right to sexual and reproductive health. They need to be treated as frontline responders and be given the critical PPEs, and they should not be deviated as emergency personnel. And finally, I would just like to refer, when it comes to data, the projections that we released yesterday and that truly predict a calamitous impact on women's health as COVID-19 pandemic continues. So the research reveals the enormous scale of the impact of COVID-19 is having on women as health systems become overloaded, facilities close or provide a minimum services to women and girls such as family planning, prenatal and antenatal care. Also, what we are foreseeing as major global disruptions in the supply chain, they can also lead to significant shortages of contraceptives. And it's already been mentioned, but I'm going to highlight it again. Gender-based violence is expected to soar as many women are trapped at home for prolonged periods. And it has already been mentioned, but I'm going to reinforce it. The fact that most of the referral pathways depend on the crime being reported, we know that a lot of the violence that's going on inside their homes now is going to remain invisible. So yesterday we released a report, projections, that say that if the COVID spreads, we foresee that 47 million women in 114 low and middle income countries will not be able to access modern contraceptives. And this will mean 7 million unwanted pregnancies. We also project an increase in 31 million additional cases of gender-based violence if the lockdown continues for at least 6 months. And also because of the disruption of the programs that we deliver on the ground, and I'm going to give you 2 examples, because resources have been reallocated, because priority has been given to other areas. We foreseen that the disruption of the program to prevent female genital mutilation while diverting the resources and the political attention to COVID-19, and also all the challenges that we have in reaching out to communities, in doing advocacy, we foresee 2 million extra new cases of female genital mutilation in the next decade that could have been averted. And the same goes to our efforts to end child marriage. The disruption will also potentially add 13 million child marriages taking place in the next decade that could otherwise be averted. So my final message with all this data is following suit with with the guidance provided by the Secretary General, Antonio Guterres, when he says we are all in this together. And one of the recommendations is to mitigate the impact of the crisis on women and girls, including on their access to sexual and reproductive health and rights, protection from domestic and other forms of gender-based violence, and ensure their full and equal representation in all decision-making on short-term mitigation and on long-term recovery. What we hope is that all this data and the examples that I can provide you, if there's a follow-up questions on the work that we are doing to mitigate the impact of this daunting numbers. But we hope that the data and the examples and providing them with the gender lens will help to tailor the responses to COVID-19, but also will help to mitigate the risks of having women's health, their sexual reproductive health and rights, their political participation, their economic and empowerment, because all this comes in tandem, to be put on the back burner of the priority list, waiting for next emergency to happen. Thank you, Charlotte.
Thank you, Monica, and thank you for highlighting the important issue of intersectionality at the beginning of your remarks. Now, finally, we will be looking at the big picture and the impacts of the crisis on the international governance aspects in the area of gender equality with Ambassador Flores Sierra. As we said, or as Anneken said at the introduction of this RightOn discussion, 2020 was slated to be an important year for gender equality. Mexico, as one of the co-hosts of the Gender Equality Forum, was to play a crucial role in that regard. How does Mexico, together with other supportive states and the UN, intend to maintain momentum despite the COVID-19 crisis? And what should the Human Rights Council do to heed Antonio Guterres' call to place women's rights at the center of the international efforts to build back better? Ambassador.
Thank you. Thank you very much, Charlotte. I want to thank very much URD and Norway for inviting me to participate in this virtual panel. Indeed, 2020 was intended to commemorate the 25th anniversary of the Beijing Platform for Action. The events around this anniversary, including the Generation Equality Forum, which was going to take place in Mexico and Paris, had the objective of highlighting progress and challenges on gender equality. The forum was postponed to 2021, but this gives us the opportunity to reflect on how COVID-19 may represent a further rollback on progress made, or more positively, how it can be a window of opportunity to mobilize action, political will, and resources. As you know, the discussions on gender equality in multilateral spaces have been facing rollbacks in the last few years because of stronger conservative voices related to ideologies contrary to the achievement of full and substantive gender equality. Countries like Mexico, whose foreign policy is unconditionally committed to the advancement of gender equality, have been at the forefront, resisting this pushback. Luckily, leaders such as the Secretary General and the High Commissioner, as well as many other states and women's organizations, share this view and these values. The collective effort of all of us has definitely contributed to resist the pushback. Nevertheless, conservative forces are still there and may want to take advantage of the pandemic to push for further retrogressions in women's rights. Previous panelists already addressed the increased burden that women face regarding care work, access to abortion, domestic violence, among many other issues. Multilateral discussions in spaces like the Human Rights Council and the General Assembly need to be part of the response to these new or aggravated problems, putting a special attention on specific needs of women and girls during the crisis, using a permanent gender lens in the analysis. The attention of the Council and other human rights mechanisms, such as special procedures and treaty bodies, can contribute to the prevention of violence and discrimination. These problems need to be addressed in a coordinated and timely manner, taking into consideration the crucial transformation that the world has seen in the last few months. The General Assembly has already taken positive steps, such as starting discussions on resolutions highlighting the impact of the pandemic on women and girls, and how the crisis is deepening pre-existing inequalities and vulnerabilities. The General Assembly should send a strong message calling for effective and meaningful participation of women in the response to the pandemic. This message should avoid fragmentation in order to reflect the unity that the international community requires in these challenging times. Mexico, and I'm sure other countries, will make sure that the Council's discussion on this matter include a specific focus on the rights of women and girls. As part of this process, the Secretary General's and the High Commissioner's recommendations on gender equality could be reflected in resolutions of the Council, which could give them normative value. We hope to have the support of many of you when these discussions take place. I thank you very much again for inviting me to share these comments.
Thank you very much, Ambassador, for those remarks, and also for underlining once more the importance of female participation in decision-making. And I hope that as many countries as possible will support your initiative. I now have the pleasure to hand over the floor to my co-moderator, Natasha, who will bring in the questions from the audience. Natasha, you have the floor.
Thank you, Charlotte. First of all, on behalf of the DiploFoundation and the Geneva Internet Platform, I would like to thank you all for very insightful interventions, and it is our honor to have you with us today. Our attendees have been very active in the text chat, raising many interesting comments and questions. Given that Madam High Commissioner has to leave us soon, I would like to start with her and the question for her that was asked by the permanent representative of Sweden to the UN in Geneva, Ambassador Veronica Bard, who noted that from the previous health crisis, we have seen that health systems are put under a lot of pressure and that services for sexual and reproductive health tend to be limited or pushed back, for which women and girls pay the highest price. So Ambassador Bard therefore raised the following question: how is the UN system working to monitor and act to ensure women's sexual and reproductive health and rights in the crisis? Madam High Commissioner, the floor is yours.
Well, thank you very much, and I thank the Ambassador of Sweden for that question. Well, we are following it, and I think not only us, of course, UN Women as well, and UNFPA, as you heard Monica, we are following clearly on one hand on which has been the impact on the health of system, on the diversion of resources to COVID pandemic, and that have meant in many places the closure of shelters, the closure of health and reproductive and sexual services, and of course we have seen also with lockdowns the problems of some women to get to maternal care or to give birth in adequate conditions. And every time we are seeing this, we have been brought these issues to the governments. We also have done a press release informing on the importance of the measures to constrain the spread of the virus, but on the other hand, to try to avoid the unintended consequences that could mean a lot of problems for women. Fortunately, in some countries, as I said before, like Spain, like Portugal, like France, on the gender-based violence, for example, they have considered that these are essential centers and they maintain the services. In France, they even have rented hotels for the women who need to be confined but not with abusive partners. In places like Argentina and others, they have developed codes and in partnership with pharmacies where women who it's difficult for them to call when a abusive partner is close to them. They have developed sort of codes so they can say that they're in danger and they can be rescued by rescue teams. So there's a lot of things going on. And we have been calling upon governments to ensure that, of course, we need to respond to the COVID pandemic, but we need to ensure that all the health access of health and sexual and reproductive services, but also others, because it looks like a lot of surgery that was not so essential has been suspended, cancer treatment has been suspended and also affect women. So we need to ensure that women have and girls can have access to health services, including health and sexual reproductive rights. And so we have been calling on our guidance on that. The Secretary General and us as well, and I'm sure UNFPA and UN Women as well. And I want to finalize saying that I should have mentioned particularly Norway, because on the female leaders, Norway has a prime minister. And I wanted to mention because I talk about the great creativity in the solutions, and not only the prime minister did a plan of action that was needed, like testing for people, confinement, etc., or tracing the contacts, or what WHO has mentioned, but also she did a very interesting thing, that she did press conference with children. And then she explained to them very clearly and transparent way what was COVID-19, what happened, what needs to be done. So not only talking to the adults, but also children that will come back home and convince their parents that they should follow this instruction. And I wanted to mention, because we are working with you and the Norwegian embassy, but I think it was very interesting and a special, I would say, initiative that I wanted to point out. Thank you very much.
Thank you, Madam High Commissioner. Thank you for sharing, for providing us with this overview and for sharing the UN perspective on this, but also of some of the UN member states. We have less than 10 minutes, so like in the first round, we will keep the interventions to 2-3 minutes. So I would like to now move over to Mr. Mohammed Nasir. We have received a question from Katambi Joanne from ISOC Uganda, who noted that there is still a challenge for women persons with disabilities who do not have access to information about the pandemic because they lack devices. So Joanne asked, how is the UN ready to address this issue? Mohammed, over to you.
Thank you very much, and it's a very pertinent question. It's not only about working with women with disabilities during COVID, but working with women with disabilities and people with disabilities across the board. And it, again, as Madam Bachelet have said earlier, this pandemic amplifies the challenges that those who do not have access to services are facing day in and day out. What we've done with WHO as UN Women, we have incorporated in the guidelines SOPs to work with and for women who are facing disabilities under COVID. Whether it was going through public announcements on the radios and on TVs about the hotlines that they need to access, we have also prioritized, and we're as UN Women, we're in discussion with certain companies that have simple, smart gadgets at affordable price that can be accessed by underprivileged communities that disabled women and girls can utilize on the immediate and medium term. Again, unfortunately, the COVID pandemic is amplifying the challenges that we are facing, especially amongst those who are lacking the access to the services, especially disabled women. Back to you.
Thank you, Mohammed. You made some very excellent points. You spoke about the helplines and the tech gadgets that could help individuals and particularly women in precarious situation. And actually now I would like to go over to Ms. Dubravka Šimonović. We have received many questions on the situation of women migrants and refugees, and they most certainly fall in the category of women in very precarious situation. Melissa Lenz asked, how can we help migrant women during this pandemic, and how can we ensure that the issue of isolation that they are facing in some refugee camps and the violence, including sexual violence, what can be done to strengthen their safety?
Very much for this question, and it is certainly true that they face additional problems with respect to their status as migrant women in situation of migration. and they do not have sometimes available all those services that are needed for victims of gender-based violence and violence against women. There are some states, they have adopted very important measures related to situation of migrant women and refugee women, and they have decided to grant them temporary permissions to stay in the country and to have additional protective measures during the COVID pandemic. So something like this is needed because this is extraordinary situation. They have additional problems even without COVID, and in COVID situation is more complicated. So we have to really focus on states' responsibilities related to human rights of all women, including migrant women, refugee women, all women that are in difficult situation related to their status and COVID.
Thank you, Dubravka, for this overview. I think you touched upon some very relevant issues that that most certainly concern women in precarious situation. Now I would like to go over to Ms. Monica Ferro, and this question is particularly interesting for me from a data perspective. We received a question that asks, is the UNFPA collecting data disaggregated to ID women and girls with disabilities? And if so, could you share with us a little more analysis of that data? Monica, over to you.
Yeah, now I can hear. I'm sorry, Natasha, I didn't hear the first part of your question. Data on?
Collecting the data disaggregated to ID women and girls with disabilities.
Okay. Yes, well, that's one of our biggest challenges and one of our biggest asks. And let me just say something before addressing that issue, which the answer is yes. One of the big issues in even trying to do projections for the impact of COVID-19 in women and girls is that from the previous diseases outbreaks, we don't have quality disaggregated data. So some of the projections we are doing, they are based on data that was gathered but not properly treated and disaggregated according to international standards. This is why I also made the point of mentioning the census and all the data that we have from recent census that can be used now to do quick population mappings. The truth is that for all the vulnerable groups, I don't like to call them vulnerable groups, they are people who are put in a situation of vulnerability, but for all of them, we try to collect the most disaggregated data we can in order not only to see what's the scope of the challenge, but also which type of interventions work the best in the sense of empower them and allowing them to be fully empowered and to enjoy a fully engaged life in their communities and in their societies. For women with disability, we conducted a study, and we have a steady and ongoing relationship with the special rapporteur also when we conduct the studies. But we have a study that it's called We Decide, where we try to map all the challenges and then go through some of the key elements. I could just quote the High Commissioner because she provided the overall explanation for this, but that go from not being recognized, their challenges and their specific needs when designing the programs and the policies, and providing treatments of one size fits all, not even taking into account the different types of disabilities and the different types of challenges that people with disabilities face when having to interact with medical systems, with health systems, and the overall theme would be a lack of priority because there's a lack of visibility. So this is where, as you were saying, Natasha, data and policy come together so that programs can be tailor-made and can have an impact. But if you want, I can share the link here of the report of our report We Decide that provides many information on people with disabilities and their access to sexual reproductive health and rights. Thank you, Natasha.
Thank you, Monica. That would be excellent if you could share the report with us, because we conduct a lot of analysis on data, and this is certainly something that we could look into, given that inclusion is such a inclusion of individuals who are marginalized is something that is very, very relevant. So last but certainly not least, we have a question for Ambassador Flores Liera. Given that we only have 2 minutes left, I will try to be very, very quick. It is a very short, but I would say rather complex question. You spoke about the specific needs of women and girls. You also spoke about the need to avoid fragmentation in the provision of a response on the women's rights. So how can we motivate women to support each other?
That's a very relevant question, because I think now it's very clear that if women want to finish the discrimination and to advance, we need to work together. It's not only women, we also need men, and we need whole of societies, whole of government approaches. And I think that's very challenging. And this is why when I said that this pandemic, and also was mentioned by several panelists, is really putting before us all these inequalities. We are seeing all the inequalities at once, and we are seeing exacerbations as well. It is a big challenge. It is a big challenge, and at the same time an opportunity, because once we are aware of how behind we are, we need to mobilize better, we need to do more together, and of course this requires a whole society, but a lot of support for women. So these are challenging times, but also windows of opportunities. And we hope that by working together, by continuing this exchange, by continuing with the purpose of the Generation Equality Forum and the celebrations of the Beijing platform, we can advance more, and we can, most importantly, silence those conservative voices that have prevented us from moving even further.
Thank you. And now I would like to give the floor to Anniken for the closing remarks.
Now that we have approached the end of our discussion, we would like to ask the audience a final question. Does the COVID-19 pandemic and the ensuing economic crisis accelerate progress towards gender equality and advance women's rights, or does it amplify the backlash that was already felt in the past couple of years? Well, that's an interesting result. I think we still have a lot of work to do left, with 79% answering that it will amplify a backlash. So I think we just have to keep up the hard work. And I wanted to thank you all for joining us here today. I think we have heard some very interesting inputs from our panelists and attendees today. And we are looking forward to meeting you again next week, next Wednesday, when we will be discussing a new question, and that is of privacy and data protection monetimes. So thank you very much for joining today, and have a very good day, everyone. Thank you.